Hello, hello, hello. This is Dr. Valerie Mukanga from Healing Wings Dental. And today, what I want to talk to you about is this subject about wisdom teeth. So many people wonder, do I really have to get my wisdom teeth removed? And so that's what I would like to dive into briefly today. So first of all, what are wisdom teeth? The wisdom teeth are molars. They are the last to erupt and they're all the way in the back. So if you go from the front of your mouth all the way to the back, it will be the, if you are, of adult age, or usually they erupt between 15-year-old to above. Obviously some people are more and usually 18 and above, but I've seen some people where they're starting to have their wisdom teeth erupting even as early as 15. So it will be those last teeth all the way back. And how do you know that you have, to have them removed? Basically, you would go to a doctor. Not everyone need to have their wisdom teeth removed. That's to be cleared. Something to be cleared about is that everyone does not actually need to have their wisdom teeth removed. And why would you not need to have your wisdom teeth removed? If you if your wisdom teeth have erupted in a way that is straight, meaning that they're all the way up, you probably won't need to have your wisdom teeth removed. But at that, you want to make sure that your oral hygiene is good, because, for some people, it's very difficult to brush all the way back in a manner that is effective. So even for those reasons, sometimes a doctor might recommend to have wisdom teeth removed. But the main reason why a dentist would recommend to someone to have their wisdom teeth removed would be because they are impacted. And what is having teeth impacted? It's just a big fancy medical term to say that your teeth did not or are not erupting in a straight manner. So oftentimes we will be able to either determine it by doing a clinical exam, or more than likely with your radiograph. So you would see that whereby your teeth are supposed to be straight like this and lined up in relation to the adjacent tooth or the tooth that's right next to it. An impacted tooth would erupt in a way where this is your adjacent tooth and or the second molar, and then the tooth that is impacted is erupting in a way where it's actually encroaching that tooth. So it's not straight, but it's leaning against that particular tooth, and at that it will never come up straight. So why is that important then for that to be removed? It's important for that to be removed because what it can do is it can start causing pressure. Some people come to the office because they are experiencing a lot of pressure all the way back here, and it really hurts, and that's because the teeth are impacted. And with that, what the problem can happen is that a problem that can occur is that with the pressure of the eruption pressure that is caused, or forces that is caused on the adjacent tooth, we have seen many cases where the tooth is leaning so much that it's starting to cause cavity on the tooth that's next to it. And so I have in many cases had to not only end up removing the wisdom tooth, extracting it, but also now the at the where the oftentimes wherever that cavity starts happening on the tooth that's adjacent to it, it's in a position where it has damaged not only the crown or the top of the tooth, the part that you actually see, but also the root. So once the root is affected, really it's almost impossible for that to be restored. And so you end up not only you losing the tooth that you're not using, the wisdom tooth, but also losing the tooth that would have been perfectly fine in the first place. So that's one of the reasons, is if it's impacted and the impaction is affecting the tooth adjacent to it. Other people can experience impaction around the jawbone. So the tooth is trying to come up straight or even, leaning, and then, it's causing a lot of pressure around your jawbone because it's kind of like trying to rub right there. And so for those reasons too, you would have a dentist telling you or advising you, recommending for that wisdom tooth to be removed. That's going to alleviate the pain, and also, it's going to relieve, cause you help you, obtain relief at that point. You can also see some teeth that are impacted as well around the soft tissue, or like your gum. And so you'll see, these kind of people, or people would come to the office, and they feel like, there's food that gets stuck under that, part of the gum, which is called operculum. And so that tend to swell up and causing pain, and even sometimes you can happen having infection on that area. So I mean, these are not all the causes, but I just wanted to share a few reasons why you could be recommended to have your wisdom teeth removed. Also, when people are not able to brush properly, especially all the way back, they can end up having bone loss around that area, and then it's now affecting the teeth that are adjacent to those particular teeth. So, those are kind of like reasons. So some of the reasons why a dentist would recommend for someone to have their wisdom teeth removed. And if you are one of those people who are experiencing maybe pain and you're in the area, we do take out some wisdom teeth. So you can come and we will give you a consultation, and we will direct you accordingly. And obviously, if you're not in the area, please find a great dentist that can actually assess your problem as well and lead you in the right way. So if you are in the area, we are Healing Wings Dental. We are located in Arlington, Texas. Coming to our office, we absolutely love our patients. We treat them with care. We help them regain or maintain their oral health so that they can soar in life. Healing Wings. So we are located at 4101 West Green Oaks Boulevard in Arlington, Texas. Our zip code is 76016, and our suite number is 317. So we are here. If you need to secure an appointment, don't hesitate to call us, 972-213-0202. You can also go to our website, www.healingwingsdental.com, where you can request an appointment, and somebody will be sure to contact you in a timely manner to make sure that you have an appointment so we can address your needs. And the waiting period is not months. We can see you within the week, more times than none. So that's what I wanted to share with you today. Should you have found this information pertinent to you, and you think that it's going to help your friends, your family members, your coworker, whoever is in your life, please don't hesitate to share this information. And that's that. I just want to wish you a very, very great day, and may you soar in everything that you do. Bye.